Here, of course, we're also going to find the sensory system. The whole sensation is actually, the whole system of sensation is actually placed in the dermis, most of it, of course. And we're going to see some other neuronal structures extend to the papillary layer and even actually touch the basal membranes of the rest of the cells. For example, the Merkel cells are actually in the epidermis, and there, of course, there are neuronal sensation cells. We're going to find two different types of structures here in the sensory skin system: the unencapsulated and the encapsulated. First, we already talked about the unencapsulated, the Merkel cells, which are actually responsible for the light touch, and also they help us understand the texture of the object that we're holding or touching. This is the first one. The next one is going to be the free nerve antics that are responsible for the pain, for temperature, for itching, and for tactile receptor. Lastly, we're going to see the unencapsulated. We're going to see the root hair plexuses. This detect the movement of the hair, and the point, of course, they are in close functional relation with the protrusion muscles, that are the muscles that actually control the erection of the hair and, of course, the falling of the hair. This is exactly the rationale of the hair. And we'll see that this mechanism actually has a specific purpose, and the purpose is that whenever a hair is erect, it actually tends to form this layer on the skin that actually covers one big part of the, and actually extends, let's say, the layer of the skin of the epidermis, in order to assess, in order to ensure one more layer of heat loss. So this is to prevent, of course, heat loss. This is exactly the reason why we have this this hair erection. Now we're going to see also the encapsulated structures, the Meissner's corpuscles, that are mostly responsible for, and they sense the skin deformation. We're going to see also the Pacinian corpuscles that are responsible for vibration, for pressure, and coarse touch. And in fact, if you actually see the structure of the Pacinian corpuscles in the microscope, you're going to see this, let's say, circular concentric layers of this concentrically structured structure. It's very, very easy to understand, to identify. We're going to find also the Krauss and bulbs, but these are only located around the penis and the vagina in the cases of the Krauss and bulbs. And last, we're going to find the Raffine corpuscles that are responsible for the stretch and tension, the sensation of these mechanical properties of the skin. So this is pretty much what we're going to see. This is the Raffine corpuscle. This is a more flat-like structure that is deposited, of course, in the layers of the dermis. The Krauss bulb, we're going to find again only the genital areas of male and female systems, exactly right here. This is the morphology. And as I told you before, the lamellated, or also called Pacinian corpuscle, this is exactly this concentric structure of fibers. And exactly, we already saw the Merkel cells that are deposited within the epidermis, typically close to Stratum Basale. And this is pretty much what I wanted to talk about the sensory skin system. So let's actually see these structures in the microscope. So even macroscopically, like in this very low magnification, we can see the three layers: the epidermis, the dermis, which is the most of it, and last we're going to find the hypodermis, which is again easily seen because of the high amount of the adipocytes exactly in the top. So if we zoom in the outer layer, of course the epidermis, we should start seeing the layers that we discussed before. So here we have, of course, the stratum basale, the one that is, of course, is in direct touch with the basal membrane and exactly beneath it the subepithelial loose connective tissue, as always, of course. And this is the typical cuboidal appearance of the cells. You can see the difference in the nuclei. For example, take a look at this nucleus and nucleus of the different layers exactly on the top. It's much different, and actually this reflects the increased mitotic rate of the stratum basale. So exactly above, we're going to find the spinal, the spinosum layer, the stratum spinosum or spinal layer, and we can see that if we follow the let's say the periphery and the outline of the cell, that it has this more, let's say, stretched out appearance of the cell. This is because, of course, we're going to have the connection between the keratins of one cell to the other on the desmosomes. So this is exactly the final result of this spinal appearance of the cell. Exactly what we're going to see, we're going to easily identify the granular cell. This is the stratum granulosum because of this granular appearance. Again, here we have the production of these two granules, the keratohyalin and the lamellar, exactly right here. Directly above it, we should be able to find the stratum lucidum, but of course in this case, in this structure, it's not that easily and clearly seen. And actually I'm going to show you in just a bit in a different section where we can actually see these 2-3 layers of the lucidum. It's not always easy to see it and easy to identify it, and this is because some sections do not have it. And of course, again, this is because of the mechanical result, that the lucidum is actually a result of mechanical compression between the layers of the skin. And lastly, we should see the stratum corneum, this thick layer of dead cells. You can see there are no nuclei present, and this of course reflects the absence of an alive cell. And this is just practically in this location, we should consider them as structures, as dead keratinocytes that actually simply have the points of connection with the dendrosomes again. Here we're going to find a very sophisticated cross-linking and cross-section and cross-linking actually in this case with a very let's say sophisticated structure of the keratins and of course the tonofibrils in this case exactly right here. And of course again here we're going to find the maximal point, the maximal property of all these structures that we discussed, all the functions that we discussed in the skin, such as the protection of thermal, of mechanical, of bacterial, and of pathogenic, and so on and so on. So this is exactly also these dead cells can also be called squames, and that's sometimes you're going to see let's say structures above the corneum, such as this for example, and in some slides it's going to be way more let's say way thicker and way more prominent from the top of the stratum corneum. And of course this cell always tends to be the section that is of course not fully in a continuous way. Exactly beneath we're going to find of course the typical loose connective tissue with a high amount of vessels. We can actually easily identify the endothelial cells that surround the vessel, and exactly right here these capillaries. First we always start with the loose connective tissue with a very few, and we can of course tell the difference between the loose connective tissue and the dense. This of course again has to do with the proportion of cells to collagen in this case. Increased amount of cells, increased proportion of cells to collagen in the loose, and increased collagen to cells in the dense connective tissue. So all of these structures are exactly the same in the dermis. Exactly, we're going to find the papillary layer, exactly this layer. These are the papillary layer. We can see the projections of the dermis over the epidermis, and vice versa. These are the epidermal ridges that actually project onto the epidermis. And in just a bit we should find the section that actually helps us with the glands we're going to see specifically. In fact, here we have some glands. Now these are the sweat glands. We're going to discuss them in just a bit. We're going to find the two different ones, the eccrine and the apocrine. Now the eccrine glands typically have the function of course to produce the sweat. In this case the eccrine can be found throughout the whole body, and the point of course of these structures is to produce a very serous content, and the sweat of course is filled with ions and antimicrobial structures and enzymes such as defensins, such as lysase, and so on and so on. And we're going to find two different components: the secretory part of the eccrine of the glands, the eccrine glands, and the ductular system. Now it's not always that easy to distinguish which is which. Of course there is the rationale that the secretory part is going to be more basophilic because of the high amount of the production of the enzymatics. Now specifically in this case of the eccrine gland, we're going to find three different cells in the acinar part, the secretory part. So we're going to find the dark cells that are responsible for the production of the enzymes, a mixture of glycoproteins, and of course a mixture of antimicrobial peptides. And we're going to find the dark cells on one point, the same layer, and exactly in the center we're going to find of course also the clear cells that are responsible for the liquid transport from one point to the other. And exactly beneath that, so this is a stratified structure, so the first is going to be the dark and the clear cell in interchange, of course, dark white, dark clear, and dark clear, and so on. And exactly beneath it we're going to find the myoepithelium, the myoepithelial cells. These are cells that practically encircle these cells in an octopus-like projection of the cytoplasmic processes and allow and facilitate the better, let's say, motion and the better movement of the contents of these cells from the acinus to the duct. Of course, we did mention that the point of the duct is to reabsorb ions, and specifically, most commonly speaking, the sodium ion. Of course, the reason why this is being done is because the sodium, of course, is a very precious ion, and we minimize the loss of sodium exactly in this point. So in this section, we cannot find apocrine gland, and this is because actually the apocrine gland can be found only in the areas of the axillary area of the skin, and of course again the genital region, the perineal regions again in the specific areas. Now the difference is, in the morphologically speaking, we should actually see it only in this section right here in the Giancore's picture. And the only one visibly, let's say, and easy to distinguish difference between the two, the ecrine and the apocrine, is the lumen. We're going to see a much bigger lumen in the case of the apocrine in comparison to the ecrine. Now, of course, there are also functional differences in the apocrine gland, not major, of course, because again, they tend to produce sweat and they're the same structures. The difference is that the apocrine one, it's actually misnamed. Why? Well, because the production, the way of production in the apocrine glands is in fact metalcrine. The difference is that the metalcrine tends to have granules that are being, of course, degranulated from the cell towards the lumen, and the difference of the apocrine is that the apocrine method of degranulation of production is the loss of the top parts, the apical parts of the cell. So whenever you hear the term, typically speaking, in glands, locolunar to tall cuboidal, this is the first giveaway that this should be, statistically speaking, of course, in most cases, a way of apocrine production. Of course, and last we have the holocrine. This is of course mentioned in the video of the epithelia, which is the whole cell itself becomes the product. And the ideal example to talk about the holocrine secretion is in fact the sebaceous gland of the skin yet again. Now, in the thick skin, we're not going to find, of course, hair, so we should look for them in the thin skin. And in this case, this is going to be the structure that is exactly next to the hair. We're going to talk about the hair in just a bit, but this is the first point of identifying the gland. So, of course, because we have this holocrine secretion and the whole cell is the product, and in fact, this is cell that the sebaceous glands are in fact are producing, of course, lipid related structures and a lot of cholesterol granules and cholesterol components and many different type of mixture of lipids. And of course, the sebaceous glands are always, typically speaking, next to the hair follicle. So whenever you're looking for one because you want to show it to your teacher, to an examiner or whatever, the very good instinct will be to actually find the hair follicle and then identify the sebaceous gland exactly surrounding it. And the opening, of course, is against the hair as we know it, and we'll see it in just a bit. So the morphology is exactly this empty looking cell, and this is of course because we have a high amount of lipid exactly within the cell. And in fact, at the point of the production of the lipid, of the sebum, the cell itself is being dissolved, the nucleus is being lost, and the whole cell becomes the product. And this is the typical morphology and typical appearance of the adipocyte in this case. So that's actually visualized in the microscope. So let's actually visualize the hair, and along, of course, with it, the sebaceous glands. Now, the sebaceous glands are, of course, surrounding the whole structure. As we can see, this empty looking, this lucid appearance of cells, this is exactly the perfect giveaway that this is exactly the sebaceous gland that is, of course, a product of lipidic structures. Now, of course, this is the hair, and this is the perfect opportunity to talk about the structures of the hair. Now, of course, we're going to start from the outer to the inner part. We're going to see the glassy membrane surrounding of course, the hair itself. We're going to find exactly beneath that the external root sheath that surrounds the structure of the hair, the internal root sheath, which is the innermost part of one of the most inner parts of the cell, and last we're going to find the hair shaft that is composed of the medulla, as always the innermost part, and the bit exactly between the medulla and the internal root sheath, we're going to find the cortex of the hair. So always, not always, but in sometimes you'll be able to visualize the adductor pili muscles, of course the one that erect the hair in this case, and they can be typically seen because of the typical morphology of the smooth muscle cells that are exactly surrounding. And of course, histology guide is a perfect tool to help you understand that exactly by the arrows in this case. But even if you're not able to, we should know by the morphology and by the differences in the colors of the nucleus and the morphology of the nuclei, and this contracted actually morphology of the nucleus, that this is a smooth muscle cell, and this should be your giveaway that this is the smooth muscle that we're looking for exactly in this section. So, and as always, in the last part, we're going to find the hypodermis, which of course is a layer filled with loose connective tissue, yes, and of course a high amount of fat cells and white adipose cells exactly surrounding them and covering the whole layer of the hypodermis. And before we finish, I want to of course show you again the structure of the hair, because honestly, because of the different sections, the different ways and different directions that we have the sections of the hair, it is not always easy to identify the whole layers, and by that, so this is the ideal example to talk to you about exactly this structure, the hair. Of course, the surrounding connective tissue that surrounds the whole hair follicle, exactly this glassy membrane is going to be just this eosinophilic surrounding of the hair itself. We're going to have the external root sheath, internal cortex, medulla, and the cuticle. It is exactly the structure between the cortex and the internal root sheath.